Fart mask. The call. Friday, 6:32 p.m., 25 Charlie. Hemorrhage laceration. 5-year-old male. 3850 Las Vegas Boulevard, Excalibur Hotel. We arrived to find security jumping up and down, waving their arms, trying to get us to notice them. They direct us toward the side entrance. No fire department yet. And after unloading the gurney and setting the monitor, emergency bag, and backboard on it, we were off. Protocol demands we always take all our equipment with us whenever going into a hotel or airport, just in case we need it. I told you, we are a lazy bunch. Unless you're dying on the floor in a public area of the hotel, security usually escorts us through the maze of employee tunnels. This means we must waste maximum energy and time getting to you. Finally, we get to King Arthur's Court dinner show, and it's like Dex called it on the Code 3 drive over. It was a kid with a cut on his finger. No blood, and it happened so long ago, they forgot 911 was even called. I canceled the fire department just as they came through the door. Ha ha! The kid didn't even want a Band-Aid for his owie. After leaving the scene, this was the discussion we had on our way out. How stupid are these people? They called me and my partner Dex, tell you later, to evaluate their kid. I'm fat, not that fat, and have smoked pot every day since I was 12 years old. Me, a guy who had to deal with some 400-pound bitch from Children's Services telling me how my environment was unsafe for children because I liked crazy trailer trash women. These people called me to evaluate their kid, and I brought my partner Dex, who has a list of problems at least as long as mine. He used to do meth and likes his women even trashier and nastier than I do. If you have to call us to evaluate anything concerning your child, embarrassment and shame should be what you're feeling. We start walking back to our ambulance, and this is exactly what I mean about wasting system resources. A cut on the kid's finger did not need a 25 Charlie Code 3 911 response. But the hotel doesn't want to be sued, so they call for every little thing. That and the city receives federal funding based on the quantity and severity of emergency calls. So the natural response is to upgrade everything so they can get more federal funding than deserved. What a scam! The city taxes their citizens to pay for emergency services, then sells those rights to a private company that's going to bill you. Then they cheat the federal government out of even more money, all of which is ours. And they still can't stay within budget. Multiply that by every city in our country. Security was escorting us out through the main lobby when I spotted him. Heart rate 76, blood pressure 104/68, respiratory rate 1202/93, blood sugar 144, temperature 99. The incoming patient. It was in his eyes as soon as he saw us. It was in his stagger. That's one. As he changed direction for interception. I pulled a pair of gloves from that little pocket in my EMS pants because this movie is familiar, and as they went on, I was already calling out to Dex. He was a white guy, about 45 years old, a little taller than me, but real thin with neck vein distension, which means he, most likely, has a liver problem, probably Hep C. He was wearing a dirty jean jacket with a matching dirty Batman bail bonds hat. In Las Vegas, the bail bonds businesses outfit our homeless with hats and shirts. Free advertising. Now he's standing directly in front of me, swaying, with eyes rolled up into his head. He confesses to taking pills because he wants to be dead. Yay, a transport. Then he politely covered his mouth, burped, and excused himself before collapsing at the knees. Good things my gloves were on, because I would have let that fool fall face first and transported him as a trauma patient before ever touching him without them. And that's exactly why we always have to take all our equipment with us. Instead, I was able to catch him by that dirty jacket, smoothly spin him around, and lay him out on the gurney. Booyah! Who's the man? Fortunately, Dex had already removed the emergency bag, monitor, and backboard and lowered it. Now we could get to work saving this guy's immortal soul, but first, we had to get back to the rig. Even though we have all our equipment, treating patients in the hotel lobby is frowned upon out here. Weird. As security alerts their people to this new call, Dex opens an oxygen mask, attaches it to the portable tank at the head of the gurney, fills it with just 10 liters per minute, the minimum necessary because we hate having to switch out the tanks, and slips it over the patient's face. My partner is slick. He makes this look good, and suddenly, this suicide is getting more medical attention than he deserves. Usually, with an overdose patient, we start with activated charcoal, but this guy is altered, which is a contraindication for fluids because of the aspiration risk, choking on the fluid. If you can't protect your airway, no fluids for you. I check for a radial pulse because it's the strongest. I can feel it, which means it's at least 80 over palp. Experience has taught me this. If a patient is moving fast, check their heart rate. Think meth. If they're moving slow, check their pressure. Think heart meds. And if they're altered, check their sugar. Remember that Valley Hospital incident? Dex pulled a clean sheet over the patient. We neatly tucked it around him. Neatness makes us look professional. Sat him up, and now he looked like we actually cared. Not. The important thing to note about this patient was his level of consciousness. It was fading fast enough for me to notice in just these few minutes. I stop, take a breath, and do my evaluation. Eyes drooping, slow speech, meaningless, incoherent, and rambling with a GCS of 12, faint odor of alcohol, doesn't smell like juicy fruit, gum, that's ketones, is too old for designer drugs, and he has his wallet, so he wasn't rolled or robbed. His clothes are dirty, so he's local and not a hotel guest. It wasn't poisoned because his respirations aren't wet, his muscles aren't contracted, and the event would be developing much faster. Probably not a seizure. He's not postictal, and old guys don't usually break dance. He's not altered from low blood sugar because he was coherent a few minutes ago, and the meter has him at 144, so it must really be pills or some sort of other depressant. Finally, after days of running nonsense calls, we had a real patient. Unfortunately, there wasn't much to do besides transport him to the hospital to die. And after a long sternal rub, because it takes drunks time to notice, Dex does one more test to see if he's faking. He takes a smelling salt from the emergency bag, snaps it, shakes it, and slips it under the oxygen mask, and nothing. Zero response, not even a flinch, so he headed out. As additional security continues to arrive, someone recognized the patient as a trespass, which means he is no longer allowed on property. Like a migrating bird, though, he returned to his favorite hotel to die. Funny, right? Apparently, he has taken several swings at hotel security in the past, so we restrained his right arm to the left side of the gurney, just in case he woke up. As if. The right side only because it's difficult to attack us with just the one left arm. Besides, under the pretense of trying to determine which medications he took, I cut his pockets open to see what he was carrying. And there was nothing I wanted in that nasty jacket either. Now we're in the back of the ambulance. One of the back doors is shut and a fat hotel security guard is wedged in the open space left by the other. Dex starts an IV and puts the patient on the heart monitor. We play a fun game on my ambulance. It's called the 7-Minute Medic. Basically, I train my intermediate partners to do my job. 3 of my 4 partners have become medics. So I plot my ass down in the jump seat facing the security guard, but safely above the patient's head, and we start racing. We try to see who can complete the job faster. Can he do all the paramedic monkey skills before I can finish the paperwork? I still evaluate the data. Who cares about this guy or his movie? I've already seen it. So I fill in the paperwork from memory and deduction, no questions necessary. It's that speed and attention to detail that earns me so many spins of the prize wheel. You must think I'm the most heartless asshole in the world, that I should ask him questions, that I should care, that I should show some sort of empathy or compassion, and I probably should. But he is passed the fuck out, and the story is obvious. Besides, I've already seen this movie, so I know how he got there. And why should I care more about him than he does? Let me explain how I can jump to the end, how I can know the answers from experience and from simple deduction. The most important thing to know about a medication overdose, and by the patient's own admission, this was not an accidental ingestion, are these three things. Which, how many, and when. Which pills? Since the guy was dirty and sporting a bail bonds hat, it wasn't designer drugs like Molly or ecstasy. It wasn't OxyContin or Vicodin either, because the amount of pills necessary to kill yourself would be out of his budget. So it must be something cheap, which leaves acetaminophen or a central nervous system CNS depressant like diazepam. Since the guy was staggering, it was most likely the latter, and I'm thinking diazepam. Valium is the trade name because they are overprescribed. It's a common method of suicide, and with a street value of just $2 each, is very affordable. That, and they would make you sleepy and stagger like this fool. Next, how many pills? It takes a lot of pills to successfully kill yourself. That and prescriptions are usually filled for 90 days at a time, which means if this guy was a war veteran, very likely, and probably where he got Hep C, he had insurance and access to lots of whatever it was he took, and he probably took them all. And finally, when did he take those pills? Sometimes people will swallow sleeping pills, and then, when they start feeling sleepy, swallow more. That's commitment. A cab ride from downtown would have been too far, the pills would have started affecting him by then, and security would have noticed him staggering on the way in. Maybe. Besides, there are lots of hotels closer to downtown, so this guy came from south of the Strip, or one of those weekly hotels on Harmon or Tropicana. Either way, he didn't have a room at the hotel. Again, no money. So he probably took the pills once he got here. Probably washed them down with a few complimentary drinks while playing slots. That's living the life in Vegas. Excuse me, sir, would you like an ambulance chaser with that suicide cocktail? Conclusion. Lots of muscle relaxers over the last 2 hours. Booyah! Seriously, who would you rather treat you, me or fire? Tough choice, I understand. Keep reading. Currently, the heart monitor shows 68, which is okay, but will drop soon. Blood pressure is low at 102/64, but still acceptable. In about 30 minutes, though, he will decompensate and Brady down. His blood sugar is 144, a little high, but definitely not related to the current problem. Maybe tomorrow he can follow up with his primary physician. Always time for witty banter. Meanwhile, the guy is coming in and out of consciousness and mumbling something about something, but we don't care, and instead are listening to the fat security guard tell us all about our patient's previous antics. Yes, we were listening to security while doing everything else. After all, we are professionals and trained multitaskers. Dex is doing the paramedic monkey skills, starting 2 IVs, taking a blood pressure, and printing a strip when he realizes the oxygen mask is still attached to the portable tank. Meanwhile, I'm doing the paperwork when I see Dex stick the tubing to his ass before switching it to the truck supply. He opens up the valve, and when the oxygen pushed his fart through the tubing and into the mask, the guy sits straight up, swats it off his face, and loudly mumbles incoherently before collapsing back into unconsciousness. The smelling salt, which I guess we left in the mask, didn't wake him up, but old man Dex's fart did. I documented the effort as patient positive response to noxious stimuli. The guy, heart rate 86, blood pressure 98/62, respiratory rate 1202 99, never said anything after that, and it was time to transport. His movie was about to end, and I didn't want him in my rig when it does. It's all fun and games until they crash. It's important to a medic's career that the patient be at the hospital when they crash. Just ask my old partner, Janie. The patient was going to need to be intubated soon, so we transported quickly, but no lights and sirens for the moment. During transport, I put an adjunct, oropharyngeal airway, in his mouth to keep his tongue from including his airway, and a nose hose, nasopharyngeal airway, in too. His breathing was shallow, but still 10 per minute, so I didn't have to bag him yet. His pupils were equal and reactive, sluggish, but not pinpoint, so he did not take opiates, therefore Narcan would have no effect, which also supports my previous conclusion, central nervous system depressant claim. Besides, protocols only allow the use of Narcan when the patient is unresponsive and has respiratory depression. They do not allow its use as a diagnostic tool or with constricted pupils. It was my choice to intubate him or not, and I chose not. Why should I perform a high-risk maneuver on this idiot? Take the chance of him throwing up in my face, knocking his teeth out, or worse, something random and out of my control going wrong, and getting written up or sued by family because of it. This must be how fire thinks. Most all medics would jump at the chance to tube this fool, but he was going to die. No need to take my career with him. I had Dex flip on the lights and sirens during my telemetry to the hospital. Telemetry is a radio call giving them a report, alerting them to the details and status of my patient. Then I had him turn them off afterwards because returning hot automatically gets your chart pulled for review. The trick is to document and detail a code 2 call, no lights and sirens, but still make the hospital think you transported lights and sirens so they don't report you for undertreating. Later that night, we transported to the hospital again and found him heart rate 68, blood pressure 84/54, respiratory rate 10, O2 99%, and intubated. But it was all pointless. He would be dead by morning. Way to cost the taxpayers $1 million on your way out. Fortunately, though, Dex and I were okay. Again, stay focused on what's important. Oh, just so you know, when reading the story, it feels like we were fooling around on scene for hours. But no, our entire time with the patient was something like 25 minutes start to finish. 1 minute worth of an introduction, 2 prepping him on scene, 2 walking through the hotel, 1 minute loading time, 7 minutes doing emergency skills, 6-minute transport, 1 minute unload, 2-minute hospital walk-in, 2-minute transfer, with a 2-minute report to the nurse. The only thing we could have done differently was to transport with me doing the skills instead of Dex doing them on scene. That could have saved us up to 7 minutes, but this guy was terminal and suicidal, so it didn't matter, and neither did he. After all, why should I care more about him than he does? Maybe I am a compassionless asshole. Fart mask.